Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers. Now, your host, Warren Zeisman.
Welcome to Healthcare Sunday on KJUL 104.7, the Jewel of the Valley. This is your host, Warren Zeisman, and I'm very excited today. We have the top eating disorders expert in the whole state of Nevada. Joanna Szumski is here. Welcome to the show.
Hi, Warren. Thank you for having me.
I just wanted to give everyone a little background on Joanna. She's a licensed marriage and family therapist. She has worked in eating disorders programs in California, Chicago, and now she's recently here in Las Vegas. She's director of Outpatient Services over at Illuminations Counseling by TrueCare, and we're really excited to have her on the show. We've been getting a lot of questions from folks in the community about how to address issues they're having with some of their children who may have body image issues and things like that. So I just wanted to kind of start off by asking Joanna about some of the things that parents could look for in terms of early signs and symptoms of maybe an eating disorder or the beginning of an eating disorder. If they have a child who may be really, focused on body image issues and things like that.
Yeah, so there are several things that parents can look out for. One of those things being isolation. If you start to see your child starting to isolate, eating disorders are very much an isolative disorder. They're also disorders of disconnection. So not only disconnection from oneself and one's body, as well as one's emotions, but also from other people. So if you start to see your child kind of isolating, avoiding activities that they used to like to do, or maybe avoiding going to restaurants altogether, that can be one of the signs. Another sign is maybe wearing very loose-fitting clothing. So if they are losing any sort of weight, a lot of times they'll wear loose clothing so that no one will be able to notice. If you see your child maybe hoarding some food, if you're finding a lot of wrappers, or if you're also finding that they're just not eating much, at dinner, kind of pushing away their food, that's another sign that you can be looked for to. Again, a lot of perfectionistic tendencies that we tend to see as well.
That's very interesting. So folks with eating disorders will often wear looser fitting clothing. I find that interesting. What I thought it'd be the opposite.
No, so a lot of the times they're actually trying to hide what's going on. Like I said, it is very much an isolative and a secretive disorder, so they don't want their parents to find out because they're actually afraid of losing their eating disorder. The eating disorder is serving a purpose in their life, and it brings them a sense of safety in a place where otherwise maybe things feel a bit out of control for them.
And so you talked about hoarding of food. So I guess that means folks who are eating food, or they're pretending to eat food, and they may be
right. So I'm referring more so with the hoarding to either bulimia or binge eating disorder. So with bulimia, we see people who will binge on food, and with a binge, I mean eat a large amount of food in a relatively short period of time, and afterwards, it's followed by some sort of compensatory behavior. Usually, we see purging, so vomiting will happen as well. And in binge eating, we see that they are binging on food. So they're eating, a large amount of food in a relatively short period of time, and they're feeling that loss of control over eating, but there is no compensatory behaviors in binge eating like you would see in bulimia.
Very interesting. So I know when we were talking a little bit before the show, you had mentioned that a lot of times folks that are coming into you for counseling, they may not always necessarily come in knowing they have an eating disorder.
Right.
And so what kind of things are you looking for when you're meeting with somebody? And maybe those are some things that parents and folks in the community can look for in their loved ones to know that they might need help.
Yeah, that's right. A lot of the people that I do end up seeing actually come in seeking help for anxiety, actually, is one of the most common things that I'm seeing. So they're just feeling a great deal of anxiety in their life, or depression. Social phobia is another thing that I see a lot of people coming in for, as well as OCD. And I mean, things that I'm kind of looking for is, there are history with, I look at their appetite, I look at their sleep, I look at their lowest weights, their highest weights, eating patterns, and also, again, some of those, their personalities and those tendencies. Do we see any like perfectionism? So you get to know that a lot more after you're meeting with a client. So I wouldn't necessarily know that the first day that I meet with a client, but after a few sessions and kind of gaining their rapport and looking again into some of their behaviors, then usually we kind of uncover that there's something there. And I do look at body image as well. So kind of looking at how a client sees themselves in their mind's eye, like what is their view of their size, their shape, their weight, all of that as well.
So in terms of if I had a loved one who I thought maybe needed help, what's the best way to maybe talk to them about it?
The best way is to do it very gently. So let them know that you've been noticing maybe some behaviors and that you're just feeling concerned about some of the behaviors. So again, just a very gentle approach, showing them that you really care about them. You don't want to be too pushy. A lot of times what happens, parents get frightened, and for a good reason, right? It's scary when you find out that your child may be suffering from an eating disorder. So then they kind of hover over them and say, okay, I want to make sure you're eating this, or I want to make sure you're eating that, or I'm going to follow you to the bathroom. And that gets overwhelming for the child. So again, being there and letting them know that I'm here to support you, but also you don't want to be that, hovering parent as well. And then getting them professional help is actually really important, because there's only so much that parents can do, and sometimes it's really tough for a child to be able to open up to their parent. So it's easier for them to speak to somebody else where they can feel safe and feel like they can say anything that they want to. So really seeing like a therapist, really a multidisciplinary team. So I would recommend a therapist be involved, a registered dietitian, a psychiatrist, and a medical doctor to make sure that labs are being taken and that they're being followed as well.
If individuals in the community are looking for help, are they able to contact you?
Absolutely. Absolutely. They're able to contact me at Illuminations Counseling.
Fantastic. In terms of eating disorders and services, what happens for somebody who has an eating disorder who doesn't get help?
That's a tough one, because some people have been able to recover without getting some sort of help. And usually that happens maybe because they've found healthy relationships in their lives. Again, having that, like, the community is very important. So maybe they found that community and feel that they have been really supportive. And again, it can go away. But a lot of times what we find, it can be pushed away for a little bit. So let's say there's a mother, who maybe had an eating disorder when she was younger, like in her 20s, then becomes a mom. And her whole life is kind of focused around raising the family. So, taking care of the family, taking care of the children. And then she feels like, okay, maybe my eating disorder is not there anymore. But then once the children leave and she's there left on her own again, then those symptoms start to come back, because now there's nobody else to kind of focus that attention on. So then you're sitting there with yourself, and some of those thoughts and those emotions start to come back. So while it may look like they're resolved in the short term, long term, we see that, it's still there. So I would recommend that, as soon as someone thinks that they may be struggling, it's best to get it done earlier, get the treatment earlier. And we also see the prognosis, for recovery is just that much better as well. Yeah.
And in terms of like a person's weight, can someone still appear to be heavy and have an eating disorder like bulimia or anorexia?
Oh, so again, eating disorders come in all shapes and sizes. So a lot of times, people think that they can just look at someone and look at their weight and that they'll know that they have an eating disorder by that. But you really don't, even with binge eating disorder, I get that question a lot. People ask me, do people with binge, are they all overweight? Like, if you have a binge eating disorder, does that mean you have to be overweight? And absolutely not. Like, you do not have to be overweight to have binge eating disorder. There's people within normal range that have binge eating disorders.
I think a lot of the symptoms you were talking about before regardless of a person's shape or size, they could be experiencing some kind of an eating disorder.
Right.
And it sounds like the best thing to do is to connect them with a professional like yourself who's in tune to it and can kind of get a sense of how significant the issue is and come up with a good course of treatment and bring other professionals in when needed.
Absolutely. And, one of the key things that I have found that has really worked with eating disorders is, while I do look at all the symptoms that are going on, I pay a lot less attention to the symptoms in my therapy sessions than I do on looking at their emotional tolerance and looking at their emotional regulation. So is this client able to regulate and tolerate their emotions? Because what I've seen is that most of these clients have had a really hard time actually dealing with some of the more difficult emotions out there. So when we're looking at like anger, sadness, shame, disgust, anything like that, all they want to do is run away, avoid any of those feelings. And really what we want them to do, what I want them to do as the therapist, is really be able to sit there and lean into some of those emotions instead of avoiding them. Because once they can do that, there's no need for any of those symptoms, right? So again, focusing more on that emotional regulation and that emotional tolerance is kind of the stuff that I look for and work with the clients.
Do we see eating disorders in men too?
Oh, absolutely. Yes. It used to be seen as, I know like back in the day, people used to have this misconception that eating disorders are an adolescent white rich girl, disorder, when that it's not the case. We see eating disorders in men. There's a lot less men that come forward. A lot of the research that has been done with females, but I know they're doing some more research with males. And that just could be because men still see eating disorders as, a female disorder. So maybe it's because they're still afraid or feel some sort of shame kind of coming forth with it. But we have seen that. So in all the treatment centers that I've worked in over the years, for the last 13 years, I have seen an increase in men coming forth. And maybe, again, hopefully that stigma continues to be broken because men and women have eating disorders.
Have you seen men come in for treatment?
I have. Oh, absolutely. Yes.
So what, in your experiences with some of the men that have come in for help, what do you think some of the things that help them come forward to seek help? Because it sounds like there's a lot of like social stigma that may prevent them from coming forward.
Yeah, I think that because we're talking about it a lot more now, there's a lot, me including other eating disorder professionals that I've met with, there's a lot of presentations, and during the conferences we're out there speaking about it. And so I think that because we're talking about it, we're spreading the news and letting everyone know that, again, it's not just a female disorder. It's males are affected, like a great amount as well. And then also body dysmorphic disorder has been talked about a lot more. And that's kind of what we see in men when they kind of come forward. It's usually with body dysmorphia. So it's similar to what we see, in the eating disorders in females, but there are some differences, right? So the men are kind of coming forth wanting to put on bulk, wanting to put on muscle mass instead of like losing. So we see a lot more of that. However, some of the behaviors that they engage in, again, are very similar to what we see in the women as well, and still are dangerous. So
with body dysmorphia, is a lot of that caused through like imagery and media and things like that, or is it life experience, combination of all the above?
It's a combination of everything. Just like the eating disorders as well, because a lot of individuals ask that same question, is it the media? And yes, that's definitely a piece of the pie, but there's a lot of different factors involved. A lot of, psychological factors, biological factors, also genetics. So as I'm talking about biology, genetics is also something to look at, because a lot of clients who have an eating disorder also maybe had a mom or a grandmother or a sister, brother, or father who's had an eating disorder as well. So it does run in families. We've seen that.
So I imagine you probably worked with a lot of folks who are underweight.
Oh, yes.
And eating disorders. For a person who's underweight, when they look at themselves in a mirror, do they always see themselves as underweight, or they see themselves different than how they actually are?
Yeah, no, they actually see themselves quite different than what they are. There's a lot of distortion that's going on. So when they look at themselves in the mirror, they see themselves quite heavier and bigger than what they are. They don't see that they, are thin or anything like that. They actually see themselves as needing to lose weight. Yeah, it's very distorted.
Wow, so that must be really tough for some of their family members too. They may see them as being significantly underweight, and they still may see themselves as really heavy.
Mm-hmm. Absolutely. Yep.
So is there services that are offered to family members? Because I can imagine that they must have a difficult time learning how to be a support, to their loved one with eating disorders.
Yeah, actually, NEDA has some fantastic information for family members. So NEDA is the national, it's the website for eating disorders. It's the National Eating Disorder Association, and they have a great deal of, again, wonderful tips and just information on how parents can best support their children. So I would definitely recommend that parents look at that, and then also look at some support groups in the community as well. Support groups have been helpful for parents.
Fantastic. And can parents seek counseling to learn how to better be a better support, to their child or to their loved one?
Oh, absolutely. I love doing that. So just being able to talk to parents and how they can best support their child is something that would be really helpful. So absolutely, they can see a therapist for that.
Fantastic. Now, I know you've taken on a lot of initiatives for community education, as well as education with folks in the medical profession, as well as other therapists. What kind of was your calling to want to do that, and what do you see as kind of some of the needs in the healthcare community here in the Valley?
So are you asking what brought me to want to treat eating disorders to begin with, or?
Oh no, well, we were going to get to that for sure. That's
Okay.
that's on the list. But in terms of, I know you've taken over. Recently, you did a big presentation. I heard over at Thoreau University with their physician assistant program. Some of the students there, and I know you're doing a lot of education with not just folks in the community, but also healthcare professionals here throughout the Valley. And kind of what's been your calling to feel the need to do that?
Sure.
Are these, is eating disorders something that's typically covered in medical education, or kind of what has been your main motivation for doing that? I know you got a good response. I heard many good things from Thoreau about your presentation.
Yes. Okay. I see what you're saying. Yeah. So number one is education. I want to educate people in the community about eating disorders because, like you mentioned, it's actually not covered in, in medical school or anything like that. Like doctors maybe get, a quick course about it, if even that. And so many of these providers are actually seeing these clients out there, right? So a lot of these clients are first going to their PCP, just their medical provider. And those can be the first people that can notice and refer this client to a therapist, right, for extra services. But if the clinic or if the medical provider doesn't know what to look for, then it's difficult for them. So I want to be able to go out there and talk to these medical providers, let them know some of the signs and symptoms and what to look for in their medical examinations, right, with these clients. And that's why there's certain things that we look for also in labs, so we look at the CBC, we're looking at electrolyte levels, we're looking at the client's glucose. So we're looking at different things to, again, make sure that they're medically sound. So my passion is really in the education part and just making sure that these professionals in the community are educated on eating disorders, so if there is somebody that knocks on their door, they know who to refer that client to. So that also includes, like you talked about, other therapists who maybe don't treat eating disorders and are not quite sure what to do when they do get somebody with an eating disorder on their case, because a lot of therapists feel that they don't have enough education or experience to treat somebody with an eating disorder. So they get kind of worried. They're like, I don't know where to send them. Or I don't even know what to look for. So I really enjoy just the kind of giving them that sort of education and some of the signs and symptoms to look for. And same thing at schools, right? So just being able to educate and not only the teachers, but speaking to the students out there about eating disorders and how to notice some of these signs in family members and loved ones, and maybe themselves as well.
It's wonderful. It's wonderful work that you're doing to help educate the community and the healthcare professionals. I would imagine a lot of times a person underweight might come to a doctor and they may focus strictly on diet changes, maybe eating more calories or looking at what they're eating. Is eating disorders just about, what you're eating or not eating, or is there more to it?
Oh, there's a lot more to it. The food part, yeah, I mean, it's a part of it, but it's just so much greater. We're really wanting to look at the underlying issues, and the core beliefs that these individuals have about themselves, so really looking at their self-esteem, their self-worth, their confidence, that perfectionism piece that I'm talking about, right? Like that need for control. Why do they need to engage in these symptoms in order to feel like they're in control? So that food piece, while it's there, absolutely, it's a small piece of the pie, compared to everything else that we need to be looking at and working with.
So you're looking at the whole person,
We're looking at the whole person,
emotionally, and physically. Wow.
Absolutely.
It's pretty comprehensive.
Yeah.
What kind of levels of care are there for eating disorders? Do people just come for counseling, or are there other types of services available?
That's a great question, actually. There are many different kinds of services available. I know that, so some people, there is like an inpatient acute, right? So if you're really, let's say, severely at a low weight, or let's say your labs are completely out of whack and you just have to be in an inpatient environment, there are inpatient hospitals, and some of them will do tube feeding, right? And then there's other ones that are inpatient hospitals that will accept the client, but they don't do the tube feeding there. So that's the highest level. Then we're also looking at residential, which would be the next step down. And
so imagine for the hospital service, someone has to be significantly underweight.
You know what? And it could be underweight. That's not the only one, though. It's not just anorexic clients that we're looking at here, because somebody could have bulimia and binge eating and qualify for a hospitalization. So again, it depends on how severe the symptoms are. Maybe how many times they're, a day they're binging and purging. So if it's, we're looking at 15 to 20 times a day, then that might be somebody who really needs to be hospitalized. And then aside from the symptoms, really looking at the labs too. So we need to look at the labs and see if that would also require medical stabilization in an inpatient environment for that client. Yeah. And the next level of care would be residential. So the next step down is that. And that's, the client is still getting 24-hour supervision, but it's not in a lockdown facility. It's not in a hospital. This is in a home typically. So it can be anywhere from, 6 beds. You could have to 20 beds. Yeah, there's different kinds of homes out there for residential settings. And then the next one down would be PHP, which is also referred to as partial hospitalization. And that's where the client lives at home but is able to receive treatment at a treatment center 5 to 7 days a week, depending on the treatment center. And usually it's about 8 hours a day or so, but they're going back home. And then the next one is IOP, and that's intensive outpatient, and that usually is about 3 days a week for about 3 hours a day. So again, they're able to go home and kind of practice some of the stuff that they've been learning at the treatment center. And then also outpatient, so seeing your just individual therapist as well. So again, there's a good amount, there's different levels of care that someone can receive.
In your office, do you have other professionals like a psychiatrist that folks who may need those services can also see?
Oh, absolutely, yes. We work with a fantastic psychiatrist at the office, Dr. Abu Bakr. He's phenomenal, and he has experience with treating eating disorders as well. So yes, and that's something that I'd always recommend too.
So you had mentioned before that you're also working on developing the full continuum of eating disorders treatment right here in Las Vegas.
Yes.
Can you maybe tell us a little bit about that? I know, you can't let everything out. You can't tell us everything right this second, but just a little bit about the levels of care and and the way that you're approaching setting up these services. Give us a quick snapshot.
Yeah, so we're looking at creating a residential program with PHP and IOP levels of care. And then the most important thing is that we're going to be working with a multidisciplinary team. So again, having a medical provider on staff, a psychiatrist, dietitians, in addition to all the therapists and counselors that are going to be there. And then aside from just doing didactic work, right? So we're obviously going to be doing a lot of psychoeducation with the clients. We also want to make sure that we're providing experiential therapies as well. So we're going to be doing yoga is something that we definitely are going to be doing, and art therapy. And those two I think are really great because with yoga, it helps clients to get back into their bodies. And that's something that, with eating disorders is very difficult to do. So I think yoga is really wonderful for helping clients to get back in touch with themselves and their bodies. And then as far as art therapy, that has also been proven to be very therapeutic because a lot of these clients have a really difficult time being able to vocalize, some of the stuff that's going on. So whether it's the pain that's going on or some of these emotions, it's really difficult to find the words to explain what's going on. But when they can put it on paper, it kind of all comes out and they can kind of talk about and describe, what they have created right in front of them. So also important to include the experientials.
That's pretty amazing. So there's a lot of experiential work that's being done
Yes.
too. I think you've provided us a tremendous amount of information today.
Thank you.
I know our hotline utilizes you as the top expert in the area. I want to provide that number for everyone. It's 833-203-2848. If you would like an appointment with Joanna and her expert eating disorder team, you could reach her at the 24/7 hotline at 833-203-2848. Healthcare Sunday is sponsored by TrueCare Treatment Centers. If you or a loved one need mental health or substance abuse treatment, you can call their hotline at 833-203-2848. It was really wonderful having you on the show, and I hope we can invite you back on again in the near future.
Oh, I would love to come back. Thank you so much, Warren.
This has been Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers.